Hey, very good morning, Pagosa. It's a beautiful Friday morning, last day of June 30th, last day of the quarter, last day of the first half of the year. And we're getting ready for the 4th of July, so Pagosa is busy. But we're very glad you have us tuned in this morning. And I'm delighted to be here at the Medical Center once again. And here with me, we have Yody Aucoin and Brian Smith. They're certified registered nurse anesthetists, something like that. Did I get it right?
Close enough.
Hey, good morning, you guys.
Good morning. Thanks for having us.
You bet. CRNAs, right here. Yeah, on our show this morning, we're going to talk about pain management. That sounds like a good topic, right? And tell us your backgrounds. Like, you know, the Aucoin name is very well known in the sports world in Pagosa, so those are your kids, I take it.
Yes, sir.
That's amazing. Yeah, so they've
had a lot of fun here in Pagosa.
Oh yeah.
Great place to raise a family, and
right.
A little bit about me, I guess.
Yes.
Been here for quite a while now. Moved from South Louisiana to Colorado in 2009 and was part of an anesthesia group in the middle of the state up around Salida, Colorado. That group had some coverage down here in Pagosa, and at the time the CEO here was Brad Cochenet, and we began to grow more here at PSMC.
Yes, you did.
And,
right.
I was lucky in that they wanted to sort of get away from the group and bring in-house anesthesia, and they approached a couple of us, and we made a nice symbiotic relationship, and here we came. So started coming to Pagosa in 2011 with the group, and then finally came on full-time in 2013 and moved the family down, and the rest, as they say, is history.
Well, that's fantastic. Yeah, that's great. And Brian, how about you?
Colorado, born and raised.
Yeah.
Been in Pagosa for almost 7 years. This fall I moved here in 2016. Was out in southeastern Colorado, is where I was born, in the plains, and always wanted to live in the mountains, and ended up finding my way to the mountains with a phone call, when the old director of surgery that was here answered the phone and was willing to meet with me, and I met with Yody back then. We were able to get things figured out. Did my anesthesia training out in Pennsylvania just to get some experience on the East Coast and see that, since I had never been on the East Coast, and enjoyed that. And then did my first 8 years anesthesia in 3 years in North Platte, Nebraska, and 5 years in McCook, Nebraska, and enjoyed that, doing surgical anesthetic cases, and started doing pain management in McCook the last 5 years I was there.
Nice. Well, that's cool. Glad you guys are here. And right, talking about Brad Cochenet, that's kind of wild, because he used to do this show with me every 4th Friday of the month. Of course, this is the 5th Friday because June had 5 Fridays. But Brad Cochenet, he started this whole thing, and just thinking back to when there wasn't even a hospital here, right? It was, so a lot has changed. You guys have brought a lot of good things to the hospital. So tell us about the pain management and the history of that here in Pagosa.
Yeah, so pain management. Well, I guess I probably should just start out with just a basic background. A lot of people don't know what CRNA means, so just to sort of go through what that entails. There's different ways to get to do anesthesia. Ones where you start in a nursing background, and you get a bachelor's degree, 4-year bachelor's degree in nursing, and then you go out and do 2 years of critical care training, and then you apply to an anesthesia program for residency, and it's pretty competitive, and then you do 3 years in an anesthesia residency. So I did mine out in Miami, in Orlando, Florida, before going back to Louisiana for my first 8.5 or so years working in the charity system down there. But that's the basis for anesthesia. And then once you put in that 9 years, then pain management is another year of training where you do a fellowship. And Brian has completed his. Those are, fairly new and up and coming programs. So I'm currently finishing mine through the University of South Florida in Tampa Bay, and I'll be finished up in August. But when I moved up to the mountains and started doing rural anesthesia, instead of the city, there's a lot of service lines that were missing. People just didn't have access to things like pain management and other specialties. And so it was really way back in 2011 when I, got the idea that I needed to start working towards getting the proper training so we could offer this to more rural communities that had a need that just wasn't there. And so I did an externship through some of the godfathers of pain management through the American Association of Nurse Anesthetists. And back then in 2011, it was a one-year externship, not a fellowship, and kind of did that and went to Iowa for 6 weeks throughout the course of that year, and got trained up in pain procedures. We're really geared more towards getting away from the opioid epidemic here.
Right. So,
yeah. In the past, a mistake that we've probably made as providers was to prescribe narcotics or opioids for pain, and that was really more of a Band-Aid that all of the research has shown eventually will make pain worse.
Because it works really well at first, but then the addiction and whatnot.
Exactly. There's so many downsides to it, and there are really no upsides to it. And so, there's this big push to kind of offer interventional pain management procedures that get to the root of the problem instead of trying to put a Band-Aid or a patch on a problem that never really gets fixed. And so that's kind of how we got into this pain management program, talking back when I first got here and talking to Brad about opening a new service line here. And, we put our heads together, and we had all the equipment we really needed already. So it was just a matter of getting trained up and getting the word out so that people could come here and address their problems.
So you said that was 2009 or somewhere around then? Yeah.
So really, 2011 is when I started my formal training in pain management, and then 2013 is when I kind of came to Pagosa full time.
So Brad was still here at that point.
Yeah.
Okay. Yeah. Time flies. It
does.
It was a while
10
back.
years, wow.
Yeah, right. 10 years, and now you have Dr. Webb as CEO, and she's doing a great job. So it's just been amazing to watch the hospital. But back to pain management, and what kind of conditions do you treat with the pain management here at the hospital?
Yeah, we see a lot of spine issues. We see a lot of I'd say probably the majority of what we see is low back pain, but also chronic arthritis pain of the major joints in the body. We evaluate people that have certain types of headaches, and there's certain treatments that they can get for those. And in conjunction with the primary care providers, we just sort of coordinate how they'll manage them from a medicine standpoint, and then we'll incorporate some interventions into their regimen that
kind of relieves their pain.
Yeah, it kind of takes care of their pain, and the ultimate goal is to lessen the amount of more dangerous medicines that they need to take to manage their pain. There's just better ways now that we can take care of chronic pain and kind of get away from the old practice of just prescribing opioids.
Mm-hmm. So interesting. So we're speaking with Yody Aucoin and Brian Smith, CRNA. He's with the Pagosa Springs Medical Center. And so, Brian, anything to add on the pain management side before we switch over to?
Yeah, a lot like Yody, my pain management experience started in 2011, but it was actually in Nebraska.
Right.
And so we started doing fluoroscopic guided, meaning the use of X-ray during the procedure, to pinpoint injective therapy. These injections would consist of numbing medicines and potentially steroids or other medications as things have advanced that we can inject in
focus on where the pain is instead of more general
areas of concern, and pinpoint those by using the X-rays and dye flow studies to kind of go to that point. And back in 2011, that was something that really interested me, because not only was it technically cool to be able to do that with somebody and improve their experience of life, but it also kind of gives you something to work towards as far as knowing that this person has an experience, you're having an experience with that, and you both can facilitate each other in a good experience. And so that's kind of how I got into pain management back in 2011. And so when I did move here to Pagosa, I'd already been doing pain management for 5 years, and then was here. We were doing, a smaller amount of procedures, not advertising, not really doing as much with that as just direct primary care provider referrals and orthopedic surgery referrals. And as we've progressed along, and we're both I fellowship trained and board certified, and Yody is completing that, as he said earlier. And
so the fellowship training, is that like
it's a whole
bedside
year,
manner and kind of
a whole year of didactic pain management studying. Didactic meaning books, studying, reading, studies, like
case
studies, all that stuff, doing discussion forums in a whole curriculum. Mine was through Texas Christian University.
Okay.
And then I had 6 weeks where I had to go to Iowa and do 6 weeks of clinicals. Yody's got his in Colorado, so that was convenient for him, which is nice. And our main goal is to facilitate what we can do for Pagosa Springs in the best manner. So what we decided is that we would start seeing patients in the clinic, and not just go from literally just a referral, and then they get that referral for just a procedure, and then we do the procedure, and then they go back to their provider. So now we get a referral for pain management services. We see that patient, get to know them, do an evaluation on them, review their possible X-ray imaging, history of pain management, where the source is coming from. Review all that with the patient, and then come up with a plan, such as interventional therapy, such as pain management, injections, etc. Also, as well as physical therapy.
That's what I was going to say. So besides drugs, you have
modalities, nutritional aspects, psychological components to pain, because pain in general is a psychological process, right? I mean,
what do they say?
From its core.
Sure, yeah.
And so we evaluate all that. So a lot of times by the time you're coming to see us, you've had physical therapy, or you've had imaging, or you've had trial on ibuprofen, Tylenol, long-term anti-inflammatory drugs, things of that nature, and those haven't shown fruition most of the time.
Interesting. Wow. Yeah. So it's a real science but that's interesting, the psychological part of it too that you mentioned. So that's just calming the patient down and just saying we got this.
The fellowship's been really beneficial. I think imaging, doing things under X-ray guidance and ultrasound guidance, that's been a real game changer in the pain management world. We can do very specific treatments for certain types of pain now that just weren't available 10 years ago. And that's been one of the huge improvements, I think, that have been made in that field. And then through the fellowship training, we kind of get the newer, the most cutting edge techniques and bring them here to Pagosa.
And we often talk about the teamwork here at the hospital in Pagosa, and how you're working with this team. You've got, whether it's orthopedics or you were just talking about how, you have to kind of coordinate and work it out with their primary care people or other departments, I don't know. So it's a real team you got.
Absolutely.
Great team.
Yeah, and we're going to talk a little more in just a minute. We have 2 CRNAs here on the air this morning, Yody Aucoin, Brian Smith, and we're actually at the hospital today. I always like coming over here. It's it's a cool place. Well, not, I was going to say, too, speaking of emergencies, the emergency room's open 24/7, but on Tuesday, 4th of July, the clinic's going to be closed. Is that? I think I got an email about that, so I just might say that on the radio today. So anyway, but otherwise, you guys are open Monday through Friday at the clinic, that is, and regular hours except this Tuesday, the 4th. So we'll take a quick break and then come back and talk a little more about anesthesia with Yody and Brian. So stay tuned. Our show today is brought to you by Mountain Express. And you can get a free ride all summer long on Mountain Express. So that's actually a Colorado-wide thing that's going on. The Energy Department is paying for public transportation for us here this summer. So anyway, we'll be back. Stay tuned for more Good Morning Pagosa on the Wolf. We're back with more Good Morning Pagosa here on this final day of June and getting ready for a big holiday weekend. I think a lot of people are taking a 4-day weekend. In fact, if you drive around, you just notice even yesterday it seemed like there were so many people here already getting ready for the holiday. So, and then along with the construction, we're just having a lot of fun out there on the roads. So we're back with Yody and Brian from the Pagosa Springs Medical Center. And as promised, we're going to talk about anesthesia and types of surgeries and all that. So who wants to start?
Oh, sure.
Real quick before we do that,
yes.
If you don't mind.
Oh, sure. Brian's going to talk.
Let everybody know that there's going to be people out there that wonder what type of procedures we do. And we do radiofrequency ablation. We do epidural steroid injections, large joint injections, injections for headaches, and several different other types of procedures for muscle pain and in general. So
what's ablation? I'm not familiar with that.
Radiofrequency ablation is essentially you start out with diagnostic blocks to identify the nerves that are primarily sensory nerves, because you can't do an ablation on a motor nerve or things won't move. So they would be isolated sensory nerves that you would do diagnostic blocks, meaning that you would isolate those, do an injection on those, specify that those are causing the pain, and once you've delineated that, then you can do a procedure called radiofrequency ablation that involves placing a probe over that nerve or placing an introducer over the nerve, and then the probe over the top of that, and it actually denaturizes, which is just a fancy word for scrambles the nerve, and makes it no longer be able to communicate or not communicate as well your sensation of pain to that area that is potentially causing your pain. And so it's not necessarily an end-all say-all fix of like say osteoarthritis or such of that, but you do no longer have to feel that pain or have a significant decrease in that pain or increase in range of motion that facilitates an increase in your activities of daily living, the quality of your functional life, and hopefully increase your quality of sleep.
Yes, right. Sleep. That's key, right? Because that's how you kind of rejuvenate your cells. And
Sure.
So
I just wanted to clarify that.
Thank you for doing that, Brian. I appreciate that. Yeah, so it's not just mind over matter. It's some of this pain is real, right? You got to take care of it.
Oh, yeah.
So anyway, we're getting to anesthesia here, which is kind of when that takes place during the surgeries.
Sure.
Yeah.
So for pain management, we're kind of steering the procedure. We're doing the procedure. For anesthesia, we're really making patients unaware and oblivious to what's going on, so someone else can do a procedure on them, the surgeon or some other provider, and we just kind of take care of getting the patient to a state where they don't have any recall, they don't have any feeling of whatever procedure or surgery is going on. So
yeah, say it's an ACL or something,
Yeah. So
you numb that part of the leg and the knee.
Right. So pain management comes into play. For the surgery itself, we'll get a patient off to sleep. Like so many people have been put to sleep for surgery in the past or anesthetized, and you have to match the specific anesthesia for whatever kind of surgery you're having done. So for the procedure itself, we'll get a patient off to sleep, but for pain management afterwards, we'll use an ultrasound machine to specifically block a couple of large nerves in the leg that kind of feed that area, and basically have that area where the surgery was done, like you said, for an ACL, it would be the knee and below the knee.
What do the nerves look like on an ultrasound? I mean, I can't picture it right now.
It's if you haven't been trained,
you have to be trained.
Look really funny, but nerves kind of come across as a little brighter and more dense tissue than some of the other tissues, like subcutaneous fat or fluid is very dark, so blood would look very dark on an ultrasound. It's pretty easy to differentiate nerves from other tissues, and we use a lot of anatomical landmarks to find certain nerves in the body. All of this, like I said, comes with years and years of training.
Sure.
And looking at a lot of ultrasound pictures and doing it for a long time. So, anesthesia's, that's what we both began this whole journey by doing anesthesia, and it's kind of evolved into pain management and more involved procedures. But I've been doing this for 20 years, and the advances that have happened are mind-boggling. We've come such a long way, and we've found a way to amplify all the good things and mitigate all the bad things, like nausea and things like that you hear about with anesthesia. We've just found better medicines, better techniques to lessen the chances of side effects, basically, over the years. And
the stays have shortened because of some of this too.
Absolutely.
Probably. I mean, and the recovery's quicker.
Yeah,
things like that, right?
For sure.
Yeah. So Angela Worth put cataracts on here. That's an eye thing, isn't it?
That's right.
Okay.
Yeah. So some of the service lines that we do anesthesia for, general surgery, that's a pretty wide encompassing, practice that if you've ever had any kind of abdominal operation or a lot of skin or lumps and bumps, as they call them, are done by general surgeons. Cataracts are kind of a minor eye surgery that changes out the lens in the eye, and they require not much anesthesia. You match the depth of anesthesia for whatever procedure is being done, and so cataract is such a kind of a not as in depth of a procedure as some. And so we don't have to give a ton of anesthesia for those, but there's a group out of Durango who comes here. And
I was going to say, so you do that here then?
They do some eye surgeries here, yeah.
Okay, that's good to know.
We also do orthopedics. That's probably one of our bigger service lines. And I'll say, I feel really lucky that a lot of the staff here have come here from bigger places, and they bring all that experience and years of experience from working at big institutions in the cities, and they bring that expertise to a small town like this. And a lot of us, are very fortunate that we get to come and live in a beautiful place. And I wasn't the only one who had an eye for it. And there's a lot of great people that found this place. And I think we're lucky to have a lot of our providers here that bring a lot of experience from big institutions and a wide range of knowledge for a small town like this.
And like you, they bring their families, and then they just add to our whole social network and the schools and everything. So
sure.
Yeah, and you see a lot of the folks around town, the people that work at the hospital, and just it's a cool thing. It's we've watched this grow, and people move in and they stick around. So you must be doing something right here.
I think so. I mean, I give credit to administration, and I've watched this place grow to the largest employer in the county, and own our own ambulance service. I think that's a kind of a feather in the cap. There's so many places that have to contract that stuff out, but we, the fact that we have our own ambulance service here, owned by PSMC, I think it coordinates and it really solidifies that relationship between emergency services and all the providers at the hospital, and I think that's a really cool thing.
It is.
The expansion of the clinic and what
huge.
that is encompassed, and how much more services we can actually.
So how'd they expand it? Like, I've noticed the work going on, but what physically has happened to the clinic?
Well, I mean, just the addition.
That whole west wing, or whatever wing it is, south maybe.
Yeah.
They brought in a whole new clinic director too, Tamara. She does an excellent job and has a great vision that's moving forward, and things are progressing over there, even just on a weekly basis, and trying to troubleshoot and continue excellence. So.
There's something to be said about going through all of anytime there's growth, there's going to be growing pains. And the way that this place kind of grew fairly quickly, and throw in the curveball of a pandemic.
Right.
And the fact that, they navigated all that.
Right.
There was no rule book. There was no reference for that. Something that had never happened before. And, I really think this place did a good job of navigating their way through all the difficulties and possibilities that could have happened during that time. And so, I felt pretty fortunate that I was we were able to be a part of that.
Oh yeah, and you got to see that. That's fantastic. I appreciate you saying that too, and letting our listeners know.
Well, Yody shouted out to his family and stuff too, so I got to at least.
Can you? Yes.
I got to shout out to my wife, who's an elementary school teacher here.
Oh, good.
And does great things with the youth sports. So my kids are younger than Yody's kiddos. But I got 11 and 13-year-old that are in the school system, and we appreciate all the services in the community and stuff like that. So I just wanted to not leave them out.
No, definitely not.
When they're listening to this.
So they'll be Pagosa Pirate stars here in a few years. What grade does your wife teach then?
She teaches second grade.
Second grade.
First grade. Okay. Throughout the last couple of years she has.
Nice.
Yeah.
Well, you brought your families, and you're part of the community, the fabric here that's in our culture, and it's so neat. It really is. So back to the hospital stuff. Did anything else you want to talk about with respect to anesthesia or pain management or anything else?
I think just given some sort of a avenue for a patient that's having or experiencing pain that, most pain gets better on its own, luckily. When you kind of cross that, 3 to 6 month mark, we sort of start to consider that chronic. And when these things happen, how do you get to us, I guess?
Right, that's what I was going to get to, right. So
if you're wanting to
go to primary care and get started there, maybe.
That's how things work. A lot of practice now, a lot of the way things go are mandated by, the way insurances sort of steer things, and the starting point is your primary care provider. And then, of course, once they do an evaluation, kind of an initial evaluation, and they're educated and recognize that this is not your everyday average pain, this is something that needs a little more attention, then they'll send a referral to us. And we have a fantastic nurse in the clinic. Her name's Leah. And they'll line up a clinic appointment where we can do a more thorough evaluation and kind of narrow down exactly what the pain is being caused by and where it is, and then coming up with a very specific treatment plan for that specific problem that we identify. And so that's kind of how that works, basically through a referral from your primary care provider.
Yeah, exactly. Mm-hmm. And you can always contact the hospital and make an appointment with primary care here, 970-731-3700. But want to thank you guys for joining us on the radio today.
Yeah, thanks for having us.
Joining me in here in the conference room.
Pleasure.
Yody Aucoin and Brian Smith, CRNAs, with the Pagosa Springs Medical Center, live on Good Morning Pagosa. Have a nice 4th of July and enjoy your families over the holiday and all that. So
likewise.
Appreciate your time today. Thanks so much.
Thank you.
We'll see y'all later. Bye.